I'm a physician assistant in orthopedic surgery here at Upland Hills Health. I graduated in 2006 from physician assistant school at Downers Grove, Illinois, Midwestern University. Immediately out of school, I took a job in Marshfield, Wisconsin. I was actually in a different specialty. I was in urology. I enjoyed it very much, but as our family was growing, I grew up in southwest Wisconsin, decided it was time to get closer to family again, and that's how I got back to Iowa County. I have two boys, a 7-year-old and a 4-year-old, and a husband, and we like to do outdoor things. My parents still live on a dairy farm, and they have a few small animals, and so we like to visit the farm and do outdoor stuff there. Hiking is a family hobby together. We have a hobby that is starting to get a little more known called geocaching, using GPS to locate items out in the woods, using your GPS, and once you find it, you initial it saying that you were there and put it back and hide it. And so my boys really like it. It's almost like a hide and seek treasure hunt that we can go on. I've always been interested in science. Growing up in high school, science was always my favorite classes. Biology were my favorite classes. I got an undergraduate degree in biology. Initially, I didn't necessarily know healthcare was the direction I wanted to go. The human body was very interesting. When I first graduated, I actually did research for a while at University of Wisconsin Veterinary School. Enjoyed it very much, but I realized I was missing something in interacting with patients. One of the great things about being a physician assistant is we tend to have more time for the patient. And so I really like the fact that we get to teach people, because I think healthcare is more than just treating them. You have to also teach them how to take care of their body, and that will serve them longer than just prescribing an antibiotic or something for their pain. So I feel you have to treat the patient as a whole rather than just the problem. When I was going through PA school, we have many different subjects that we do rotations in, and one of them happens to be surgery. And once I got just a glimpse of surgery, I knew it was something that I liked doing. My very first job was in urology, and that was surgical in nature, and it just once again confirmed that I really enjoy doing surgery. So one of our goals as our family was growing, it was to get back to southwest Wisconsin, so I just kept an eye out for jobs that included surgery. And when a job came up with orthopedic surgery, I knew it was something I had to explore. It's great to be able to get to know patients and their families. We've actually had multiple generations that we've treated. So what I really like about the small town is just the fact that you can meet all these people and get to know them. I can see them at the school sometimes, or see them at the grocery store, and it's nice to be able to smile and say hi to them. You feel a bit more connected to the community when the community is this size. Upland Hills is great because it's growing and getting bigger, and it's nice to hear patients say, I love it, I can have my orthopedics done here, I can see my primary doctor here, I can have general surgery done here. They're happy that they can stay here and have all their treatments done here. Seeing the patients smile when they can finally say they're pain-free, seeing them sometimes tear up because we're giving them a new lease on life. I really like when I hear patients say, I can go dancing again, or I can walk up the stairs at the football games. So it's really fun to see that we've changed them. Majority of our surgeries are elective, but that doesn't mean they're not important. And so it's nice to see that even though it's medically not critical to have your knee replaced, it definitely changes quality of life, and it has changed people's lives.